Well, it's a pleasure to be joined this morning by Jared Beecham, physician assistant there at West Tennessee Healthcare. Good morning, Jared. How are you?
How are y'all doing?
Doing good.
His to-do list and my to-do list are way different today. That's what we uncovered in that little break.
I think everybody's to-do list is always totally different from yours.
You think?
All the time.
It's not evident.
Let's stop it. I don't know who you stole that from, but it's old. National Stroke Awareness. Let's talk a little bit about that, Jared. First of all, give us a little background on you at West Tennessee Healthcare.
So, like you said, I'm a PA at West Tennessee Healthcare. I've been a PA for 7 years. Is this better?
It is much better. Thank you.
So I've been a PA for 7 years, but I've been a PA here at West Tennessee Healthcare for 4 years in the neurosurgery department.
What's a PA?
Physician assistant.
Physician
I
assistant.
was doing that for our listeners. Thanks so much.
Some people in this region may be more familiar with nurse practitioners. So we're the equivalent of that at the same level as far as being a primary care provider, and we just went through a different training pathway, but that's what we are.
But you're in the OR, right?
I am. I'm the surgeon's right-hand man. So if you see Dr. Branch in surgery, you're going to see me standing next to him across the table doing things with him.
If you see Dr. Branch in surgery, the anesthesia is not good enough yet.
Yeah, almost happened yesterday. And it's like, oh, he's waking up a little bit.
That's not good.
That has to be terrifying.
No, it's no big deal.
No big deal.
He sees it all the time. What are you talking about?
So, in the OR, I'm his right-hand man, and then in the hospital, I'm the primary call person. So if anything happens with brain or spine in West Tennessee, they're going to call me, and then I'll go and evaluate them. And if the surgeon needs to be involved, I'll get him involved. And
now, does that include trauma?
Mm-hmm.
The trauma that's coming into the big hospital?
Yes, ma'am. Trauma, routine stuff. Somebody getting off the toilet and their back goes out.
He was bending over in the kitchen.
Thanks,
I'm
Jared.
not calling anybody out in particular.
Jared.
I told him he needed to work on that story. I did. Just bending over is like, okay.
Well, that's when it happens.
Well, even when I worked in urgent care, I saw that all the time. I've had guys come in and they can't stand up straight, and I said, "What did you do? Were you in a car wreck? Did you fall off the house?" No, I bent down to pick up a T-shirt.
Exactly. That's how it happens.
It happens.
Yeah. So let's talk a little bit about stroke awareness. Something maybe you're passionate about, or what?
So my father had his first stroke when I was in high school, and so I'm about the same age he was when he had his first stroke.
Oh my gosh!
Yeah. So my son's a sophomore, so yeah, about the same age.
You don't expect that in a young person.
You don't, and that's something we'll talk about later about the age range of strokes. But so everybody knows somebody generally that has been affected by a stroke, whether it's a family member, a friend, coworker. About 795,000 stroke cases a year occur in the United States. So one about every 40 seconds, actually. And about every 3.5 minutes, about 165,000 people total a year will die from a stroke. And so, it's very
That's
important.
Significant.
Yeah, so 165, it was I think the number 2 cause of death in the United States in 2022, which are the most recent statistics I have. So the number 2 cause of death was a stroke in 2022.
Let me ask you probably one of the most obvious questions, mainly because I don't know. Is there a difference between heart attack and stroke?
It's nomenclature and location.
Okay.
So heart attack is a stroke, or how do you say it? A stroke is a heart attack of the brain.
Right.
Or a heart attack is a stroke of the heart.
Okay.
Either way, the point is blood flow has been interrupted to the tissue, and that tissue dies. So in a heart attack, you get a blockage. It cuts off the blood flow to the myocardium. That tissue dies, and it stops pumping. And then you have the symptoms, and you have the outcome of that.
Right.
Yeah.
In the stroke, it's the same thing. You get a blood clot that comes up, lodges in one of the arteries that supplies the blood to a particular part of the brain, cuts off blood flow. Those brain cells begin to die from the lack of oxygen. Or you have what we call a hemorrhagic stroke, which is typically what I deal with more, where you have a bleed in the brain that is also a stroke. It's just a different kind. And either way, the same result. Tissue starts to die, and then we have to try to fix that if we can.
Let me ask you this. He asked you about heart attack and stroke.
Mm-hmm.
There are a lot of classic heart attack symptoms. It seems like the symptoms for a stroke can range from nothing to something really dramatic.
So stroke symptoms can be very subtle. They can be hard, even for us sometimes. We don't know exactly. We can't just walk into a room and say that person's had a stroke. We have to work them up. We have to put our clinical hats on and think about the signs,
Sure.
the symptoms, the imaging, put it all together. About 25 to 40% of ER workups for stroke symptoms end up being mimics, things like seizures, migraines, Bell's palsy, hypoglycemia. There's a whole bunch of things that can mimic a stroke, but it takes a full workup for us to really kind of get to the nitty gritty of what's going on and figure out what's going to give you the best treatment.
What do you do? I mean, when you see these signs coming on, what's the immediate reaction for the best care?
So for the general public, and I think that's, why we're doing this today with the awareness, what the general public needs to know is, first off, what are the signs and symptoms of stroke? And so confusion, speech changes, weakness, vision changes. When people start complaining of those kind of things, you need to listen and act fast. So FAST is an acronym that they've come up with. It stands for face, arm, speech, and time.
Okay.
So facial droop, facial changes. One side of the face will get weaker,
right,
and it will kind of droop down. They may have a corner of the mouth that hangs down when they speak. Well, I'll get to speak, but their face hangs down when they have that's arm or leg. So weakness on one side.
Okay.
Generally, if you have a stroke on one side of the brain, it's going to affect the muscles on the other side. So if you have a stroke on the right side of your brain, because that's what controls the left side of your body, those muscles are going to be weak. You can have some numbness, tingling, just some sort of changes there. And so you ask somebody to hold their arms up and they can't keep that arm up. That could be a sign that they've had a stroke on the opposite side.
I've never heard of that before.
Wow.
This is good information.
And then speech, the S, it stands for speech changes. So slurred speech, inability to form words, not making sense when they speak, or not even being able to understand language too. They could have aphasia where they don't understand what you're saying. They may be able to talk and follow commands, but they may not be able to follow everything for you. And then time. T is probably the most important, is to recognize and get them to treatment, because time is brain.
So if I get to the hospital and there's a suspect or there's a chance that where am I going when I go to the ER?
So you're going to go to the ER. You're generally going to go to the trauma side,
okay,
because those are the highest acuity patients, and stroke is one of the higher acuities. And you're going to get labs. You're going to get CT of the head. We're going to look for areas of changes in the brain that can indicate a bleed or indicate that tissue is dying off. Unfortunately, we can't always see that right away. We can also look for swelling. And so they're going to do things like, one thing, like if you have an ischemic stroke and you're having a suspected blood clot, they may do a TPA or TNK, which is a medicine that can bust up clots.
Okay.
To resume that blood flow.
So just deal with it chemically then,
They
right?
could.
They can?
Or we also have an IR team, interventional radiology, who can do a mechanical thrombectomy, which is where they actually go in there and snake up through the vessel and try to pick out that clot and remove it that way. Sometimes we unfortunately have to get involved, and that could be like a craniectomy. So if you've got a lot of swelling from your stroke, there's not necessarily blood to take out, there's nothing to remove, but there's just pressure that we can take off part of the skull and sew the skin back up and leave that off.
Right.
And so your brain can swell.
It can swell, and
we
then
allow it to swell, and then to come back down, put the flap back on later. Now there are things, and that's what we do at our local hospital. We are a primary care stroke center. And so there's a lot that we can do with the medications, the neurology team, the IR team, even the cardiovascular and endovascular team can have a role in stroke care, and of course the rehab for afterwards.
Sure.
But there are things that we can't do at this facility, and if we determine there's something like, say you've had an aneurysm, for instance, so we can't treat aneurysms here. That is something that requires a higher level of care, like in a university setting. So we'll do our due diligence in doing a quick, thorough workup and determining, is there stuff here that we can't control, and let's get them to a place that can serve them
I'm getting
better.
on a helicopter,
Yes.
basically.
Yeah. And those are going to be like an emergent transfer. We try to make sure that we're doing what's best for the patient.
Tell me about, because when you think about strokes, heart attacks, things like that, you automatically, I think, if you're 25, 30 years old, you're probably thinking, that's my parents.
That's old
that we're
people
thinking
stuff.
about. So does this affect younger people as well as older people more frequently, or what?
It is alarmingly, increasingly affecting people in the younger age brackets. Not exactly sure why, but
Do you have
know,
any speculation?
We're eating crap. That's
Yeah,
why.
Well, I was going to say that, but
you
you
know,
did.
we get into the modifiable risk factors, and that's probably a lot of it.
Diet.
Just our general lifestyle is getting more and more poor. A lot of processed foods, lack of exercise. You also have things like uncontrolled hypertension, diabetes, smoking, all the things that we can control.
Could it run in the family kind of a thing? Or-
Yeah, there is a genetic component to that too, but that's not a modifiable risk factor. You can't you can
can't.
pick your family afterwards, but you can't pick your family history. Right?
Yeah, that's true. True.
And so what we're seeing, there's about a 10% incident rate of strokes in people under the age of 50. And what we're seeing the most increase in is that age group of 45 to 64. There's been a 15% increase over the last decade in strokes.
Wonder why.
Wow.
And I think it.
That's
I think it goes back
concerning.
to. I think it goes back to those modifiable risk factors, underlying heart disease, which is a big risk factor.
Not
for
taking
stroke.
care of yourself,
Not
a
taking
lot of
care
it,
of yourself.
yeah.
Yeah.
Is there ways besides that we can reduce the risk besides just like our eating habits, exercise, things like that? Or-
Well, the number one cause overall of stroke, the number one modifiable risk factor, let me say, is hypertension, uncontrolled blood pressure. And I see it all the time. Unfortunately, I get people in the ER that've had a stroke and, oh, yeah, their blood pressures, but they don't take anything. And I ask the family, what have they been taking to do this? Oh, they don't take anything. They just watch it. I'm like, well, so
this is
uncontrolled
the outcome.
Yeah, uncontrolled hypertension is a silent killer. It does damage for a long time before it ever causes symptoms.
Oh,
So by the
wow.
time
Like
it
the
starts-
oil light coming on in your car.
Yep.
Things have already gone wrong.
Because it affects the smallest vessels first, and those smallest vessels are in your organs, so your eyeballs, your heart, lung, liver, brain, all those smallest blood vessels, they can't hold it, and then they just start to break down over time, and it just gets worse and worse and worse throughout the body. And so having that high blood pressure, if something happens down the road, your blood vessels cannot hold the pressure, and then you end up having a stroke.
Give us a final word on folks out there that to how to curb some of these things. And I know just number one, pay attention to symptoms.